Hi, I'm Candace Matthews-Brackeen, and welcome to Women's Tech Week. On today's episode, we'll be chatting about building resilience through perimenopause with Dr. Barbara Hanna. Dr. Hanna is a seasoned OB-GYN and Menopause Society certified practitioner with over 25 years of experience in women's healthcare. Dr. Hanna has dedicated her career to addressing the often overlooked area of menopause care, founding My Menopause RX to bridge this gap. Her work is deeply rooted in providing comprehensive menopause healthcare solutions, aiming to improve the quality of life for women navigating the significant life stage. Through her company, Dr. Hanna offers a range of treatments, emphasizing the importance of individualized care and the use of bioidentical hormone therapy, among other options. Her expertise and commitment to addressing menopause care make her a respected voice and leader in women's health. Welcome to the episode today, Dr. Hanna.
Thank you so much for having me. I really appreciate this opportunity to just enlighten other women who are suffering from menopause symptoms that there is hope.
Thank you for that. So I'm sitting here today with my heating pad as my 45-year-old uterus feels like it's trying to kill me. So this is a timely conversation for me. And hopefully the women who listen today will understand a little bit more about the way their bodies work. Maybe something that will happen to them later or something that's happening to them right now. So maybe let's first start by if you could tell us what kind of My Menopause RX is, and then we'll frame some of our definitions that we're going to talk about today.
Absolutely. So, My Menopause RX is a virtual doctor's office that offers holistic, comprehensive menopause healthcare. And I say menopause healthcare, that's a term we like to use because we are providing healthcare through the power of HIPAA compliant video audio technology. And so women who are 35 plus can receive services that are in network with insurance through our telehealth platform. The providers on our platform are all menopause trained specialists. So we deeply understand what the changes are that are associated with the hormonal fluctuations that you're experiencing. We have deep roots in gynecology with really evidence based treatment algorithms behind the scenes. And we all really honor the place of hormone therapy for women in the right woman if you're a candidate.
Awesome. Today's topic is perimenopause. What is that? Because I've done a lot of reading, and people have a lot of opinions of what perimenopause is.
So, perimenopause is a time in the reproductive life cycle of a woman with or a person with ovaries where the ovarian production of estrogen and progesterone are starting to kind of roller coaster. And so we know that the average age of menopause here in the United States is about 51. And we know that perimenopause and the changes in the hormones can actually begin even 10 years before your final menstrual period, which
Mm.
is the definition of menopause. So when we talk about menopause, it's that time before your final menstrual period where your hormones are starting to change, usually in your 40s.
And what are the symptoms of perimenopause? Just so that I know what's coming. I mean, you said 10 years. So
10
we'll have
years. So there are
potentially
over
10 years of
34 different symptoms that I could list, but I'm going to just touch on
34 symptoms?
34 symptoms
Okay.
of associated with your hormonal fluctuations.
Okay.
Absolutely. So let's really kind of check off the big ones. And then I'm going to highlight a few unusual ones that people I feel like need to be aware of. So, irritability, worsening PMS. I like to say that a lot of times mood changes in perimenopause is like PMS on steroids, right? You're happy one minute and maybe you're crying the next, or you're snapping at your children or your significant other, or you're just crying out of nowhere and you don't even understand why. So peak shifts in mood changes. You can have hot flashes. Even though you're having regular periods, you can still have menopause symptoms. So you can have hot flashes, you could have night sweats, you can have insomnia, disrupted sleep. You may have irregular periods, you may have more crampy periods, more heavy periods, you may have spotting in between your periods. You may have the beginnings of vaginal dryness, decreased libido, painful intercourse, pain with insertion. Below the belt menopause symptoms may begin, and that's urinary urgency, frequency, more frequent urinary tract infections. I've already mentioned pain with intercourse. And so there's some other vague symptoms that people don't associate with perimenopause. Joint pain, burning mouth syndrome. That's right. You can have this strange kind of burning sensation in your mouth that is actually due to hormonal changes. And so there's really a wide variety of symptoms that oftentimes we as menopause providers, women will often say, I just don't feel like myself. And I just, something is different. And that's actually a red flag for us that you're beginning to have hormonal changes.
That's a long list.
It's a long list.
It's a little overwhelming. And, as I mentioned kind of a little bit earlier, like I think this is where I'm at. This is what I've been told. And weight gain was one of those things for me. It was a significant amount of weight. I just couldn't handle it. And my trainer said to me, it's calories in, calories out. Is that true, Dr. Hanna?
Well, weight gain in menopause is complicated. So let's really unpack the truths behind that, because that is one of the most common complaints that we find with patients is weight gain. And so as your estrogen levels start to decrease, your body composition changes. And so you start to have this accumulation of belly fat from a lack of estrogen. So even if your weight does not increase on the scale, your body changes and you feel more bloated and more puffy. But there is weight gain associated about 1.5 pounds per year in the menopause transition. So I like to tell women the average weight gain, if you are not on top of and changing your lifestyle, the average weight gain is about 10 years through this menopause transition. And it's real. And so why is it real? We know there's a lot of science that we are sure of, and there's a lot of science that I think is yet to be discovered when we talk about weight and menopause and estrogen, quite frankly. And so we know that when you look at studies, your muscle mass decreases as you age. Estrogen does play a role. Muscle burns more calories than fat. And so that's why it's so important that we really tell women resistance training is really a great way as you age to help with maintaining weight. And so if your calories are not burned at the same rate as you're taking in, kind of what your trainer said, right? Calories in, calories out. There is some truth to that from a mathematical equation, but the biochemistry of how your body changes kind of alters that mathematical equation a little bit. And so resistance training, really looking at what you're eating. If you're not measuring food and looking at serving sizes, you really don't know exactly what you're putting into your body from a calorie standpoint. And this is a conversation that we have often with women. I feel as we get busier in life, right? We are the sandwich generation. We're taking care of aging parents, maybe we're taking care of grandparents, maybe we're taking care of children, maybe we're taking care of our spouse. And the last person we're taking care of is ourself. And so we start to put things on the back burner. But as our children age and we have more time, we start to socialize more. Maybe we're having a few cocktails. Maybe we're not even realizing how many calories are in those cocktails. And so when you really break down all of those changes and your fluctuations of estrogen, it creates the perfect storm for weight gain.
So let's say I'm, 35 to 40 years old and I'm starting to experience some of these things and I come across your website and
Mhm.
your org. What happens when someone starts working with you all?
Sure. So I'll take you through the journey. So, everything is done through our HIPAA compliant telemedicine platform. And the platform was created from the ground up. We don't outsource our technology. We own our technology because we took the frustrations of providing healthcare for the patient and for the doctors behind the scenes and created an experience that was hassle-free for everyone, is what we like to say. And so you'll create an account, you'll select an appointment, you'll upload copies of your insurance card so that we can make sure that you're in network. If you're not in network, we then message you and let you know that you're not in network, and you can choose to still see us for a discounted rate of $99 for a self-pay visit. And so you'll book your appointment. You'll get, we use HIPAA compliant Zoom. So you'll get your Zoom link in your patient portal. You'll push begin visit at your allotted time, and you will have a conversation just like we're having right now. Now, before that conversation happens, we do have you fill out a medical intake form. And in that medical intake form, because again, remember, we're not just prescribing medicines to sell. We don't sell medicines. We're providing holistic healthcare is what we're doing. And so you'll fill out a medical form. It's pretty comprehensive because, again, we're providing healthcare. So when we look at menopause, we're looking at your past medical history, your family history, medications you're on, allergies. But most importantly, we're having you complete what's called the menopause rating scale. That is a validated symptom questionnaire in almost every country. And it really gives us an idea of what really is happening in your life. And then how can we address those issues? We also ask in our intake form, what are the most important things that you're suffering from? How can we help you feel better? And I think that's really important because we then can drill down what's important for you as an individual having that appointment, because not everyone's the same. And so you'll have your medical visit. We may order you laboratory testing. It's incredible how many women haven't been to the doctor and have no idea what their recent cholesterols are or what's happening in their bodies. So we may order you laboratory testing if necessary. And then we talk about treating your symptoms if that's what you're interested in. And we go through a whole array of evidence-based, FDA-approved treatment choices, including FDA-approved bioidentical hormone therapy.
What is bioidentical hormone therapy?
So it is a very interesting term that is used as marketing for many companies. Bioidentical means it's the same molecular chemistry or molecule that is kind of makes up in your body and floating around as a hormone. And so when we talk to put it into simplified terms, if you think of birth control pills, everyone really is familiar with birth control pills, that they're synthetic molecules. So there's extra little molecules added on that mimic what's happening in your body, but it's not the same chemical makeup. Bioidentical hormone therapy, so estradiol or progesterone, are the same chemical makeup of the molecules that are kind of floating around and produced in our ovaries. So it works a little bit differently from a safety factor when we look at progesterone. Natural progesterone is what bioidentical hormone therapy contains, where synthetic progestins like Provera is a name, or Agestin, or norethindrone, which is in many birth control pills, they just work a little bit differently to help mimic the natural progesterone that's in your body.
So is that different than a low dose, like birth control pill?
Yes. So
Because
menopausal
that's what's
hormone
being
therapy.
prescribed by a lot of doctors.
So let's talk about why that's being prescribed by a lot of doctors.
Okay.
In the perimenopausal time frame, there's a lot of bleeding irregularity for many patients. And one of the most effective ways to control abnormal uterine bleeding, heavy periods or regular periods, bleeding in between your periods, is the use of birth control pills. And birth control pills also help with menopause symptoms. And so the combination of birth control pills, and at My Menopause RX, we like to design your use of birth control pills so you never have your period. Um, because there's no real physiologic reason, unless you're trying to get pregnant, that a woman has to have a period. We can skip a period. We design treatment in a way for a woman who is having irregular bleeding so that we eliminate the period. A lot of times you eliminate the period, you eliminate the cramping that you alluded to earlier. And then we're also controlling your menopause symptoms because we're leveling out those peaks and valleys of your hormones until you truly go through menopause. Birth control pills are safe to use up until age 55. But birth control pills are not the only answer. Even if you're having a period, you can still use bioidentical hormone therapy. And at My Menopause RX, we're all about choices. We give education, we listen, and then we help you decide what makes the most sense for you.
So you mentioned getting pregnant. And I know that many women are delaying kind of pregnancy for lots of different reasons. And sometimes waiting until their late 30s, early 40s, just based on life circumstance. Does perimenopause affect fertility?
Yes. So over the age of 35, your fertility decreases. And so we are all born as women with a predetermined number of eggs. And as we age, our eggs age with us, and they are no longer released or viable when we have reached our predetermined number. And so I remember in residency on my reproductive infertility rounds, and one of the attendings would always say, "Have your babies young," because then your eggs are most active, and so perimenopause absolutely decreases your chances of having a pregnancy, but it's not zero. So for women who are perimenopausal who are not trying to get pregnant, contraceptive is important.
Okay, so I'm just gonna be honest. This process has made me a psycho sometimes, and I am not always the nicest person. How do you bring along your family or the people in your kind of care circle around, like along for this journey? Because it's not. I am not who I was all the time.
Understood. A common statement from women, honestly. And so you have many choices, right? And so first off, educating them a little bit about what perimenopause is. And we know that anxiety, depression, mood changes are very prevalent in perimenopause, and women with prior histories of anxiety and depression and postpartum depression have increased risk of having mood changes at perimenopause. And the truth is, if you don't feel good, you're not really that happy of a person, right? You're short-tempered, or if you're not sleeping, you're going to snap. When we talk about weight gain, you're reaching for the wrong foods if you're not sleeping. And so, really educating your loved ones around you, just say, this is a time of change for me. So, if just kind of bear with me as I go through this. And everyone's different with
For
their
10
personal
years, Dr.
relationships.
Hannah, for 10 years.
Yeah, well, I mean, we think treatment makes sense, right?
Okay, this is
We
helpful. This is super helpful.
think
You're right. It's the treatment. So I've jumped too far. I've jumped too far. Keep going.
no one, no woman should suffer from menopause symptoms. And I can't drill that home enough, right? And so when we look at the amount of misinformation today, there's a lot of lotions and potions and pills and supplements and different things that are really targeted towards women not feeling well. And so a lot of that is just misinformation. And women are I feel like they're desperate for solutions. And when we look at the negativity of the Women's Health Initiative from 22 years ago, which was the landmark study funded by the NIH to look at hormone therapy, They stopped the estrogen and progestin arm early because there was an increased risk of heart attack and stroke. But I need to clarify that. The average age of the woman in that study started on hormone therapy was 63 and a half years old. We know that that is not within your safety zone to begin hormones. And that created so much fear for women that still exists today. It exists with many of my colleagues in the medical community who tell women that hormone therapy is not safe. And that is just not true. So, treatment and finding out what your individual treatment options are, because everyone's journey is unique and everyone's medical history is unique. And so, it's finding out from people who understand what's happening and are educated to what's happening in your body is most important, because you don't need to live in fear and you don't need to live feeling miserable.
So I have a group of ancestors. So my mother, my grandmother, and my paternal grandmother um, all made choices in their 40s and 50s to have hysterectomies. It has been it was for them the way they managed the symptoms of menopause. Um, and uh, when I started these conversations with my healthcare provider, one of the first questions I was asked by a nurse is, "Do you want to keep your uterus?"
Hmm.
Um, and I went to the internet and did some reading, and I, of course, didn't think that was going to be a good. I like the organs I have. I think that they're here, and I believe that the universe gave me it for a reason. And what I noticed, and what I think I knew before, was the way Black women are treated sometimes in the healthcare industry is to sometimes do the most extreme things instead of treat over time. Is there a different perimenopause menopause journey for Black women versus our peers?
Yeah. So Black women suffer symptoms earlier of menopause and they suffer for symptoms longer. So the average menopause transition for someone like me, a white woman, is 6.9 years, but a woman of color is 10.1 years. And there's many confluing factors that are associated with that, right? Negative, what you're saying, negative social determinants of health, right? The way you're treated inappropriately in healthcare organizations, which is hopefully we're going to overcome that as a medical society one day. I mean, everyone at My Menopause RX is treated as a unique individual, right? Everyone's journey is treated in a way that they were our sister or our mother or our cousin, because we're all family at some point, right? And so your journey is longer. Women of color also have an increased risk of fibroids. And so fibroid tumors, which are benign tumors in the uterus, can cause heavy bleeding, painful periods, pelvic pain. And as you're perimenopausal and you're kind of having these imbalances of the stimulation of your periods, oftentimes those fibroids can get larger. Oftentimes your periods can become heavier and more crampy and painful. And I feel that often medical providers, instead of really stepping back and saying, okay, well, here are your options for your bleeding issues for menopause, right? Or perimenopause. Continuous birth control pills so you don't get a period. Novel idea. We've been doing that for years. Why don't we offer that, right? IUDs, progesterone IUDs. If your uterine cavity is not misshapen, it's a wonderful device to control pelvic pain and heavy pain for women who want to maintain their uterus. We have made so much advancement with our medical care to help prevent and keep people out of the operating room who don't want to have a major surgery.
So, is this all bad? Um, you
No, it's not all bad. It's a journey, right? It's a journey that we all take. I think it's glorious not to have a period. Let's talk about that, right? I mean, right. I mean, that's not bad. That's pretty good. I think um, I think with proper care and proper treatment and education, everyone can manage through this journey and come out on the other side and be healthy. And I think that really needs to be the take home message, is that self-care. You should not be afraid to ask for care. And if you're seeing a provider who dismisses your symptoms, you need to go elsewhere, because it's really inappropriate, because menopause healthcare is women's healthcare. And 51% of the population are going to experience menopause.
I just wonder, why don't we talk about it? We talk about getting your period, and we talk about menopause being a thing as if it's just some point in time that something happens. Like, do we have a marketing problem here in the center?
Yes, I think, well, we think of the society we live in, right? And so the society we live in honors youth, honors beauty, honors, really thinness, fitness, right? And so when women think about menopause, or men think about menopause, they think about growing old, and they think about being old. And the reality is with, and I'm a fan of hormone therapy, so I'd like to just throw that out there. I think estrogen should be in the water. I think we'd all be happier and
Okay.
be living longer and feeling better. And so I feel that we have the opportunity to live vibrant lives, to take our years of wisdom and to continue to educate those who are younger than us. And it's not all bad. I think we need to kind of celebrate change and celebrate that next phase of life, whatever that brings for you. But you should be given choices and opportunity to feel good while you're doing that.
Yeah, absolutely. I am. Yeah, I totally agree. I totally agree. And I think as I myself been going through this journey, I think I know my body a lot more. A lot of it though, like many women, we're working through the self-care on our own, right? With the support of Google and a maybe not so wonderful healthcare provider.
Yes.
We have to give ourselves the right to go and find the right treatment, even if it's not in our own city. And
Yes, and that's really like the premise of us starting this company, of me founding this company, is that, for most of my career, I was a minimally invasive pelvic surgeon. So I understand fibroids, I understand endometriosis, I understand heavy periods, but I never recommended removing a uterus in a person who wanted to keep their uterus. We were creative in ways on how do you manage that to improve your quality of life. And when I joined the Menopause Society about 5 years ago, as patients were aging with me, and honestly, I couldn't answer their questions well enough I was kind of embarrassed of my lack of education as a doctor. And especially as an OBGYN, I'm supposed to be a women's healthcare specialist. And so I joined the Menopause Society and never looked back. And so I really, as we started to offer care and patients would ask us, "Oh, my sister is in Kansas. Can you offer care in Kansas? My cousin's in Texas," and they would ask us all these things because they wanted their own peers and their family members to get the same care that they were getting and have the same opportunities to feel better. And that really pushed us. It's a challenge, right? Practicing medicine across state lines and taking insurance across state lines, but I think we got it figured out. And we're doing pretty good because we're in 11 states right now.
good for you.
Uh, and so it is a challenge, but it's a challenge that is really worth doing, because we are told as women we can do it all, right? We can have kids, we can have a job, we can have a career, we can live a great life, we can be great, significant others or spouses, but yet we're not really given that opportunity if we're not given access to healthcare that can help us do that.
Okay, this is a little off topic. Did you think you were going to become a tech entrepreneur?
No. But it's fascinating to me how much personal growth I've made while doing this. And so, I started this company with my son, he's a techie. So he's a full stack software engineer. And as I had this idea for my Menopause RX, I approached him and I said, can you help with this? Can you connect me with someone who could build me this, who could build a telemedicine platform that's not complicated, that's user friendly, that people enjoy, that's pretty. I want a pretty EMR, electronic medical record. And so he handed me the book at the time. He handed me the book, The Lean Startup. And he said, I want you to read this book, Mom. And if you still want to go down this road, I will go down this road with you. And here we are today.
And how many years ago did you start the company?
So we founded the company in 2021, and we spent about a year building the software because we were both working, so we were doing this kind of building it on the side, and we built the software over and tested the software. It took us a little less than a year to really fine tune everything that we wanted and test it behind the scenes, and then we launched it into the universe. Initially here just in Illinois. And we launched it honestly as a self-pay program because we thought, okay, specialty care, we discounted the visits at $99, far less than anything you'll see out there for menopause specialty care. And everyone really responded with the same complaint. Please take insurance. No matter what their economic level was, the reality is we all want to use our health insurance for our health care. We pay for our health insurance. We want to use health care. So we spent the time to really create and figure out how we become in network. And luckily, as a physician founder, that we were able to obtain insurance contracts as an organization to become in network with most major insurance companies. And then we've never looked back.
Well, I could probably ask you lots of questions with my VC hat on. I love to invest in women's healthcare companies. So
we are currently fundraising.
We may need to talk at some point. I really do appreciate this conversation today. As we wrap up here, I just want to know, where can people find you and the company online?
Yes. So if you go to mymenopauserx.com, that is the link to our website, and that you can just push sign up, create an account, and then you can get some evidence-based healthcare.
Awesome. Dr. Hanna, thanks so much for joining us today.
Thank you so much for having me. I really enjoyed being here. And I just, this is our mission to help women. And so I just help lots of viewers tune in and really, whether it's with My Menopause RX or someone in your local community, advocate for some self-care.
Thank you.
Thank you.